Now let's go to the questions. Uh, okay, number one is prophetic. What medications work best to stop or decrease pulling, and what are the most effective behavioral strategies I can use now? So, if you're looking at medication, come back in June because we'll have a whole webinar on that. So, you really don't have a very wide choice of medication. There are certain types of SSRIs, like or antidepressants, who that that we have studies that show that they can reduce pulling. And then you have NAC as a supplement that you can try. There are some studies that say that NAC will reduce pulling in about 56% of the people who take it. And when it reduces pulling, it reduces it, if I remember correctly from the study, for about 40%. So that's also something you can try. But in general, what I can say from the studies that I've seen and from my clients' experiences is that psychotherapy tends to be more effective than medications for hair pulling. And in terms of behavioral strategies, I suggest that you go to our YouTube channel and then check out our webinar on habit reversal training. That is a rather simple behavioral strategy that you can implement starting from tomorrow. So that would be the quickest thing that you can do and something that you can do on your own. We have learned that guilt. Sorry, this is very unusual. Okay, so guilt and stress make us pull, but my problem is I feel so bored, so my hand goes to my head or any part of the body, and I start doing it. Sometimes I'm waiting for something to do or waiting for someone, and then it makes me pull more. In order to make it stop, what other ways I have to overcome it? So if you're looking to only reduce your pulling or keep it under control, my advice from the previous question stands, which is habit reversal training. It's shown to work. It's actually the most tested form of treatment for hair pulling. So that's the way to go. And in terms of what you wrote here, I wouldn't say that stress is a precise definition of anything, because stress is essentially anything that yanks your body out of a state of equilibrium of some sorts. So stress can be good, stress can be bad, guilt is stressful, sadness is stressful, an orgasm is stressful. So it's not really very precise. And especially boredom. Boredom is right up there with feeling uncomfortable on my list of undesirable words. And if I had the possibility to implement a filter which will block out or censor certain words in TrickStop, I don't have this ability, by the way. But if I did, boredom and feeling uncomfortable would be among those. Because when people say boredom, they never actually mean boredom. Boredom as a state of mind simply says one thing: change your activity. It's very simple. However, if you investigate, so in that sense, if you feel boredom, the message of boredom is that you need to do something else or change the way in which you approach whatever you're doing now. That would be a generic constructivist response. However, if you dig a little deeper into what is your actual experience of boredom, I think you might discover that there's a lot more going on underneath the surface. Pay attention to if you're bored. So sit there and be bored. And then pay attention to what your thoughts are like what is it you start thinking about? And then pay attention to what you're feeling. And if you can't define an emotion, then just pay attention to what's happening in your body. Pay attention to your chest, shoulders, abdomen, legs, this kind of forehead, this kind of triangle between your eyebrows, and just see what's happening. And you will see that boredom is not this static, uneventful thing. It's actually incredibly eventful. And very often, what hides beneath the surface of boredom is anxiety and worries and all kinds of fears. So boredom is never just boredom. You might learn a lot more about your triggers if you go there. I've never felt calm during or after pulling. Instead, I feel anguish, pain, and tension the whole time and after. It feels torturous, not calm. Yeah, well, I did say that it's for most people. Um, there are people who, for example, don't experience any of the negative things that you've mentioned, even though most people experience a mix of both. So, I, I mean, yes, your experience is absolutely correct. I very rarely make claims of what's true for everyone. So yes, this does happen. Can pulling also be a pacifier? Yes, that would also be a kind of avoidant mechanism. When can a child start? Do you mean the program or pulling? My daughter has been pulling since the age of 2 years and 9 months old. Oh, that's what you're asking. Okay, so when we look at how when and how hair pulling starts, there's one study that I read, but it was a while ago, so I don't remember the details. But what left an impression is that you can basically, when you look at the profiles of different people who struggle with hair pulling, there are essentially two paths to hair pulling. One includes this very, very early onset, and then the second one includes adolescent onset, more or less, like that period. So puberty and then on. So a good part of the people actually start. I've had clients who would report, or rather, by their parents, who would say that they even pulled as children. I don't know exactly if you can consider that hair pulling when a baby does it, because we don't really know what the behavior means. We can just observe it on the outside, but it's not uncommon that children start pulling at a very young age. Your daughter can still benefit from any type of treatment for hair pulling. It doesn't change the prognosis. In fact, um, I don't know how old she is now, but the sooner you seek treatment, the better. Because when a habit becomes kind of deeply ingrained, then it gets more functions over time, so it's more difficult to deal with it. Can I improve without medications? Yes, most people do. I take Zoloft to try and stop my hair pulling. So yeah, Zoloft would be one of the SSRIs that are prescribed for hair pulling. Um, Studies say that it does have some effect, but it's hard to say, because I'm tempted to say that based on my clients, it's not very effective. But then I have to remember that people for whom it works wouldn't actually come to therapy. So my sample is skewed in that sense. But there are several studies that show that it is effective to a degree. I have been struggling with trichotillomania from the ninth grade. I tried a lot to stop, but all in vain. I feel so embarrassed in gatherings, and I made up my mind 100 times that I will stop pulling, but I can't resist. When I'm alone watching TV, using my phone, feeling stressed, I start pulling my hair. What strategies can I apply to stop it? So, obviously, like I said, the first line would be habit reversal training. But here you seem, so among the things that you wrote here, it sounds like you already have an idea of sort of what is it that you don't know how to handle, what is it that you're avoiding, right? So some of it is stress, from what I understand, or whatever you feel when you're alone. This is also something that warrants investigation, something you can think about. And then once you figure out what that is, then this is exactly what you should be dealing with. And this might require a little more treatments that are more complex than simple habit reversal, because habit reversal is basically just a very simple behavioral intervention. It's not something that's going to yield great insights. So other deeper, let's say, types of psychotherapy might be more beneficial for that. What can be the best alternative to do when you feel the urge to pull your hair? What would be the best technique to do at that moment? This is a question that's so general that it's almost impossible to answer. The techniques that you're referring to are probably just competing responses, but what is it that would work for you is really very, very dependent. It's very specific, very individual, and sometimes there's not even one answer for one person. And why is it that I say this? If you only pull in one place, then yes, perhaps you can find one thing to do and then be done with it. But usually people don't pull in only one place. So, for example, if you pull in your bathroom and you pull at work, you will obviously need two different techniques. There are always some general guidelines as to what is that you do. You find something that's very inconspicuous. You find something that you can use even in front of other people. And when you look at all the situations in which you pull, you try to find the smallest number of competing responses that can be applied in most situations. And always, and I really mean this always, introduce them one by one. What people do is they will spend some time gathering information. They install our self-monitoring app, and then they enter as much as they can, which is excellent. I always encourage self-monitoring. And then they will select 7 different things to do when they feel the urge to pull. And almost inevitably, this fails because everything that you're substituting pulling with is supposed to be a habit, because you're substituting one habit with another. The idea that you can introduce 7 new habits at the same time is just highly unrealistic. Let's put it this way. Humans don't adopt new habits very easily. So you do 1 or maybe 2 at the same time, but not more. You test a competing response for, let's say, a week, see if it works. If it doesn't work well enough, eliminate it, and then introduce another one. And then slowly build your repertoire. There are some very simple things that will work for most people, like, I don't know, stress balls or infinity cube or these kinds of gadgets that would keep your hands occupied. But specifically what would work for you, you would have to spend some time analyzing uh, where you pull, how you pull, what triggers you to pull, because all these might require different approaches. Will this presentation be recorded? Yes. In a day or two, when I record it, I will send it to have it uploaded, and then it will be on our YouTube channel. And since you registered for the webinar, you will receive an email notification. If you can get past the guilt aspect of pulling and start to feel proud of yourself for not pulling for a period of time, can you break the cycle? Tyrosine has helped me so much and makes me feel good about myself. Took away my urges after 15 years. Wow. Very happy to hear that. In terms of what you asked here, whether or not so if you can change the way you understand guilt and not see it as an excuse to beat yourself up even further, you can definitely immediately reduce pulling, because you don't have that extra cycle generated by even more guilt, right? So if you're able to stop yourself, and then as soon as possible, obviously, and then be kind to yourself and study what happened there, absolutely. But whether or not this is a complete solution, I don't know. That depends. If this is all that your avoidance is about, then yes. But if you're in general, let's say, struggling to handle stress, as someone mentioned, then a fuller solution would be to actually look at the ways in which you can deal with stress in a healthier way. Sometimes that means introducing some kinds of, I don't know, like self-care habits. Other times that means making serious cuts at work or at home, or saying no to your friends sometimes. So I always emphasize that these long-term solutions are really what you need to look at. Can hair pulling be treated without using medication? So we had something similar. So the answer is absolutely yes. In fact, psychotherapy tends to be more effective than medication. I feel like that also. I'm not sure what that refers to, but okay. Since I don't know what it means, I don't know what to say to that. What's the best way to go about telling a partner about hair pulling? Well, what I would suggest, well, first of all, I would come up with a very coherent and simple explanation about it. I would try to remove shame or any kind of justifications or any of these things. I would try to make it as simple and as direct as possible. And then what I would do is I would prepare, in my mind, what I need my partner to do if they see me pull, because this is usually where shame and stigma come from. And this is also sometimes a source of great frustration. So I would have very specific instructions for my partner, and then I would provide them some space to ask questions. You can also refer them to TLC's website, because they have a few very nice texts that present different kind of facets of hair pulling and certain theories and opinions so they can learn more about this. And I would always insist that I have control over how much information I'm providing and at what time. Because sometimes when people hear about hair pulling, it may seem strange to them and they might ask very difficult questions or something you're not willing to share. So you have to be ready to set boundaries where it's right for you. So that would be like a very general thing. If you have a more specific question, just ask away. I tried NAC, but it made me extremely nauseous. I throw up regularly. Is this something I should have pushed through, or is this normal? So this is a side effect of NAC, and I don't think you should have pushed through it because, well, why would you do that to yourself? But maybe what you could have done is started with a very low dosage and then increase every couple of days or every week or so. And then your organism would probably get used to it a little bit better. But there's really no reason for you to suffer throwing up every day. Speaking of compassion, that would not be a good idea. I've noticed that most of my guilt that I have with my hair pulling is due to it affecting my appearance. I also have body dysmorphia, and deciding to change the construct of wanting to improve my appearance would be affecting one of my main forms of identity. So how would I better change my behaviors? For example, I put on makeup to look nice, but it also makes me ashamed that I wear makeup to hide the damages I've caused from pulling out the hair in my face. Well, what you said there is really crucial, is that changing the way you relate to your appearance would be a change in who you are. But isn't that exactly the kind of change that you need to deal with body dysmorphia? Because if you, so I don't know if this is something you've been formally diagnosed with, or is this just what feels right for you to call, your relationship to your body? But wouldn't that be precisely the core of the dysfunction? So something that should be changed. I understand that it cannot be changed overnight, but that would be the core of the issue, no? So I would maybe suggest that, I guess maybe you can do two things. You can, all of the practical techniques that I mentioned would work for you as well. So you can still work on stopping the pulling, even if this issue remains. But this is definitely something to address through therapy. And if I may suggest so, usually kind of long-term or psychodynamic therapy is what does a good job for these kinds of changes. Because CBT tends to be very impatient and very kind of matter of fact and down to earth. So when it comes to these deeper issues, uh, I guess more long-term kind of therapies would work. I bought a band that vibrates when it senses that I'm going to pull. It's still on the way to me, but I'm scared that it wouldn't help because I feel like even then I will bite my hand, I will not stop. Why can't I stop even though I know I'm going to cry and I know how I'm going to look after? So these bands, I don't know which one you bought. There are several on the market, but whichever one you did, that's fine. So once you train them, they can be quite useful as reminders, especially if most of your pulling is the so-called mindless or unconscious pulling or automatic pulling. They can be really very useful because every time you move your hand, they will make you aware of what you're doing. But usually this is not enough to stop. So I suggest that you implement some techniques to help you. Like, for example, on top of the band, you can add something that you do to redirect the urge, like a type of a competing response, for example, and then combine these two. And also, because this is also a self-control issue from what I understand, you may want to consider implementing stimulus control techniques. So to change your environment to minimize the triggers or to physically just disable yourself from pulling. Like people like to wear gloves sometimes or finger covers or band-aids or something, because then when you touch your hair, it doesn't feel the same way. And sometimes you really can't physically pull. But most of all, and this is really just my impression, so I could be wrong, but the vibe that I was getting from this is that you're extremely impatient. No matter how effective any type of treatment or therapy is, patience is always absolutely necessary. So just be kind to yourself and try to be as patient as possible. There is no change without failing a million times. So you will fail 5 times, succeed once. Then you will fail 4 times and succeed 3 times. And so you will improve over time. Remember what I said about guilt. You should always learn from guilt, because that way it's not wasted bad emotion. You do something productive with it. And the same thing goes here. You fail, you go back, see why you failed, try something else, and then try again. As Beckett would say, fail again, fail better. But this is really in therapy or out of therapy. This is always how psychological change works, because trying out something new is no guarantee of success, but it is the only way to succeed. Sorry, I don't have anything more uplifting and optimistic to say. Um, I feel like my hands need to be doing something. A lot of times that means feeling strands of hair, pulling my hair, or picking at my face or body. I do this even when my arms get tired. Is habit reversal the best way out of this? It is certainly a way out of this, because habit reversal will help you find different ways to keep your hands busy. And this is good because you'll minimize the damage that you do. So you can certainly benefit from it. But if I were you, I would try to observe a little bit that this sensation that your hands need to be doing something. There are several things that, this can be due to, really 2, 3, 4 things, one of which is an obvious one, like anxiety. So in that case, once you figure out what's happening, what causes this need to move your hands, when you understand it a little bit better, then you'll be able to find, actual solutions that go beyond competing responses. So I would suggest that you learn how to observe this. If you listen to the beginning of the webinar, at some point I shared how I asked my client to just keep her hands in her lap and then observe them. This could be a good exercise for you to try. How can my partner support or help me overcome my hair pulling? Well, first of all, figure out what is it that you need from your partner. Do you want your partner to point out the pulling or not? Do you want your partner to stop you? Do you want your partner to hold you accountable? So there are several roles your partner can play. See what feels best for you. Um, if you live together, your partner can be an excellent, like the vibrating band that someone mentioned. Well, that can be a role that your partner plays, and they can help you become aware of your pulling quite a lot. But for them to do that, they need to do it in a way that doesn't frustrate you and doesn't make you feel bad. So think in advance, what is it that, what kind of signal would you like? Should they say you're pulling, or a keyword, or I don't know, just hold your hand, or touch your shoulder or something? Like, that's one way that they can go. Another thing that you can do is your partner can actually help you implement some techniques to stop. Alternatively, your partner can be there to help to make sure that in case you have those pulling trances where it's incredibly difficult to just get out of them, your partner, as someone who's outside, can actually do that for you. And then also you can have your partner be your accountability partner. So you can make a schedule of how you will reduce your pulling, and then your partner can make sure that you stick to the schedule. So there's really a lot of things that your partner can help you with. How do I access the habit reversal? Well, if you want to learn about it, we had a webinar on the topic, so that's where it's outlined entirely. Um, I'm trying to think if I can remember a book that describes only habit reversal training. But as with everything tonight, my brain failed me at this too. Um, there are some books that will outline similar treatments. But either way, you can look at our webinar. That's the fastest thing to do, because you will have really all of it just broken down into steps, and then you can start doing it yourself. The first half of TrickStop as a program is devoted to habit reversal training. So that's always something you can do. And a lot of therapists will know how to implement habit reversal training. Maybe not for hair pulling, but principles are the same. Everything else is really just them adjusting it for your specific needs. Um, does it make sense that my hair pulling has escalated during the pandemic? I've been more isolated over the winter. Absolutely. I think, I mean, I'm not a spokesperson for everyone who struggles with trick, but judging by my clients and the number of clients that I've had since the pandemic started, absolutely. Yes. I think it's mainly due to the fact that anxiety levels have just gone through the roof. And then pulling is a way to deal with anxiety. Okay, let me see. So your questions keep coming and coming and coming. Uh, let's take one more, and then maybe we can slowly end for the evening. Um, when I pull my hair, I also put the hair in my mouth. Sometimes I swallow the hair. Is this a dangerous habit? Well, certainly, if you can not do that, that would be excellent. There is a complication that happens sometimes, although it's not very common, but it could be potentially serious, which is the people when people swallow the hairs, they don't get eliminated always from from your bowels. Instead, they stay in there and kind of create like a hairball, which has a disgusting name. It's called trichobezoar. And then when this is created, this can actually obstruct your bowels. This is very slow to form, so it's not something that happens overnight. And it doesn't happen to everyone. However, when it does happen, sometimes it even requires surgical treatment. So if you can skip the swallowing part, that would be an excellent thing to do. And in general, when you have these parts of the pulling process of the ritual that don't include the actual pulling are sometimes more important than pulling itself. So this is something to observe and think and experiment with and try to modify in some way. Because just recently there was a client that I had, and I suggested that she modifies something that she did after pulling, like touching the hair, playing with the hair on her lips, and then arranging the hair in a specific order. So I suggested that she interrupts one part of that cycle, and this significantly reduced pulling for her because it wasn't as pleasurable. It lost some of its appeal because I guess the central component for her was this, let's say, after pulling ritual. Okay, so this is a good place for us to stop. I see that there are some questions that I didn't get to. Actually, quite a number of them. If your question is urgent, you can email it to either me or our support team, because we have a psychologist that can answer your questions there as well. Otherwise, I hope to see you all in June, and we will be talking about pharmacological treatments for hair pulling. Well, have a pleasant afternoon or evening or night, and see you in June.